Hello, Jenny 2024, hello, JA across Europe, and welcome to another exciting podcast, The Roads to Gen E. It doesn't stop, and it doesn't stop because, as you all know, we have over 6 million young people across Europe who this year alone have gone through JA programs, and I'm sure that they have different challenges. So, what are the most important health challenges and what to do to be part of a positive change today? I'm sure you're encountering those. I'm sure you're thinking about those. If not, this is the right podcast for you to follow. Yeah, follow, like, and share. We're going to follow, like, and share on this podcast on Spotify and on our YouTube channels. Am I the expert of those things? I'm not. No, I'm not. I'm not the expert. That's why our podcasts always get the best of the best. And when we're talking about it, best of the bests, we definitely talk with individuals who are championing change. And I'm very glad today to have with me Zoe Lawson. Zoe is senior scientist at manufacturing science and technology at Johnson & Johnson. Jay, hello, Zoe.
Hi there. Nice to meet you, Salvatore.
Very nice to meet you. So, J&J, Johnson & Johnson, is partner of Gen E, is supporting the next generation. So we're very glad to have you here with us today and discuss about the challenges in the health sector. But before entering into that, imagine when you were 16 years old. Is this the kind of job you always dreamed about? It? Is this a sector you always wanted to work about? It? Did your career took a different path?
Way back in the midst of time when I was 16, I would say actually yes. I think I'm very fortunate. I always really liked science. It was my favorite subject at school, and I went through a period of wanting to be a meteorologist, forecasting the weather, but finally decided on biological chemistry. Went to university, did a bachelor's degree, did a PhD. And now I find myself in the production and manufacturing of new drugs and therapies, particularly in relation to innovation in manufacturing of new drugs. So yes, I think yes, I'm pretty happy and very lucky because there's a lot of serendipity involved, right?
And we are lucky to have you here with us today. So it's nice to remember, no, a little bit. I always think that if you want to design your future, you need to look at your past. And the future, actually, of healthcare, it's very much impacted by technology and innovation. But how can we leverage those things to improve healthcare delivery and access, particularly given the resource constrained settings that we are all living with?
Yeah, I think actually we're in a perfect time period at the moment because we all have our mobile phones right now. We can all see that, we all know what we're talking about with our mobile phones, and I think this is something that's really an enabler. And even in resource poor settings, people have mobile phones. They maybe don't have a smartphone like we have in Europe, but almost everybody has a mobile phone. So mobile health solutions are really a big thing, I think. They're a way of providing healthcare information, preventative information to people, particularly who are in remote areas, who maybe don't have access to a healthcare centre or a clinic because they physically can't get there, because they maybe can't afford to get there. Maybe there are other barriers related to the geography or the urban centre that they're in. And that's a really great, pretty low tech and low cost way of getting information out to people. And also people can, they also send a text message to communicate with the nurse. Oh yes, my symptoms are better today, or actually I need to renew the medicine. And so I think mobile health is a really big one, but there's many other things as well. There are things like I know I've seen, and I think my own company has been involved in programs where drones are used to take things to people. So we would, for example, charge the drone with some medicine, and it goes across a mountain or a piece of desert, and it takes medicine, it takes supplies to people in remote areas where otherwise it might take days or even longer to get medicine out there. And so the idea of, we think about
More
drones as,
affordable and easier, obviously.
absolutely, yeah. This kind of thing, I mean, super interesting.
Yeah. I mean, as I said, we look at the past to design the future. So when there was a bad things happening in your health, normally the first things you would do is, pick up the phone at home. We didn't have mobile phones, and call the hospital and call the ambulance, right?
Yeah.
What we are so there is always a need of connection there. What we are trying to use now is the fact that we're always carrying on a mobile phone with us, so we're not necessarily at home. Also for preventable, in order also to transfer data, right?
Absolutely.
To prevent issue, right? Yeah. And also, yes, people think about, physical health, definitely, but there is also something related that is taking more and more interest, but also that it's worrisome, which is mental health. We see many cases, especially in the young generation today, right? So detected earlier and here that we are seeing it, the importance on investing in mental health program, good mental health program for the young people. So what are some of the effective approach to addressing mental health issue on a global scale?
So I think you made the really important point there that mental health is actually the only chronic illness that primarily affects young people. We think about other chronic health conditions, heart disease, cancer, that primarily affect older populations. But mental health affects everybody, and young people are particularly vulnerable to this. And so, some of the things that can be leveraged and can be done to address this, there's obviously lots of different approaches, but education is particularly one of these things. So promoting awareness of the different kinds of issues, and raising people's awareness level, and reducing stigma, making people, especially young people who perhaps don't have as much information, making them understand, letting them know that it's okay to share information, it's okay to talk about these things, and to promote education through, I think, so again, we come back to the mobile phones, and we come back to social media. Particularly campaigns that target younger people tend to be quite effective when they're on those kind of channels. If you're using, say, Facebook, that's for middle-aged people now, as I understand. things like TikTok and Snapchat and those kind of channels, education through those kind of channels, which targets young people in particular, to let them also to allow them to be aware of their own symptoms, shall we say, or their own situation, so that people can say self-diagnose, but recognize signs when things might not be okay in themselves, but also in their friends as well. And I would say that's another thing that people can take as an action for themselves is, pay attention to other people as well. Today, okay, maybe Valentina, she doesn't seem so well. Ask her, is she okay? It's incumbent upon us, for ourselves, but also as part of our communities, our friendship groups, etc., to be aware and to keep that front of mind. And that also helps to reduce the stigma, I think, because that's another thing. Mental illness is invisible unless we talk about it, right? Unless we actually
openness of disseminating,
exactly.
understanding. It's
absolutely.
be something that people need to share about it, and exactly not stigmatize it completely. Absolutely.
Absolutely.
A lot of things have been done on this, and I'm sure, obviously, J&J is leading different educational campaigns across the globe about it. Let me also focus a bit. You touched upon, a drone that goes into a remote area, but we are seeing, that the quality healthcare for vulnerable population still exists. There are plenty of barriers for the vulnerable
Sure.
population to access to quality healthcare. How can we overcome those, right? I mean, if this is a fundamental right, health, it's a fundamental right for human being. Though there are always those who are left behind for different reasons. You mentioned one of those. There is a geographical barrier, right?
Yeah.
And how we
Yeah.
can access to hospitals, how can they access, and technology is definitely leveraging. What other kind of barriers we can think about it?
Yeah, I think the first and the most pervasive one is the financial barrier, right? Just if we look at financial resources and poverty, this is probably the largest barrier, right, for that prevents vulnerable populations from accessing healthcare. And how can we overcome that? It's a perennial problem. It will continue to be a problem. Healthcare, especially high-tech healthcare, is expensive. It's expensive in developed countries, that doesn't mean that just because it's expensive we wash our hands of it and say, okay, well, sorry if you can't afford it. That's not acceptable, and it's not a solution. And I think that's where we do need to look at innovations, like the things that we've mentioned already, things like telemedicine, but there are also other things like targeted low cost healthcare innovations, things that can be deployed in the field. And what do I mean by that? I mean things like we would call point of care diagnostics. And to give an example of what that is, that everybody would be familiar with, would be a COVID test. Everyone's done at least one, I'm sure, COVID test. That's a point of care diagnostic. It's very low tech. We know, swipe your nose, put it into the little tube, put some drops onto a strip, and it'll tell you if you're COVID positive or not. This is low tech point of care style diagnostics.
The most easy detection, early detection of anything. So the more
Exactly.
we move towards, it's easy to transfer, it's easy to get the data. It's a self-testing in some of the cases, so it doesn't require the help of a professional continuously, right? So,
Absolutely.
yeah.
And to follow up on that, if we stay on the COVID theme, since it's relevant and everybody's familiar with it, things like, if we take the vaccinations for COVID, most of us in Europe would have had a vaccination that came out of a refrigerator. This is really not a great solution for much of the world's population who don't have access to refrigeration. And when we talk about refrigeration, often the thing needs to be kept refrigerated from the time it comes out of the factory until it goes with your arm. If at some point it's been sitting at 30 degrees in a warehouse, that there's no point in putting it back in the fridge. At some point it's finished. So we need interventions, innovations in healthcare that, for example, don't need refrigeration. And the J&J vaccine was one of the vaccines that was used. The COVID vaccine was used in quite large parts of the developing world because it didn't need refrigeration. And so that kind of thing is one way that sort of lowers the barrier, to the financial barrier to accessing healthcare in vulnerable populations.
We're talking about global problem. We're talking to individual responses together with global responses. But what are some of the practical steps that individuals can take to prioritize their own health while at the same time contributing to broader and address global health challenge? Because at the end of the day, health, you're very concerned about yourself, right?
Yeah.
I mean, it's fundamental, right? It is fundamental. But how can you translate and make some practical steps that while you're doing good habits, you're taking good things, you're also contributing to address global health challenges?
Yeah, so it's a great question, and it makes me think of the analogy that we hear, that you may have heard, that when you're on a plane, they always tell you, or you hear, that if there's anything that goes wrong, you should put your own oxygen mask on before you start helping other people, for obvious reasons. If you run out of oxygen, you're going to be useless to anybody else, right? So we do have to start with ourselves. And so therefore, the very first thing would be practice self-care. Let's start with ourselves, that we're in control of ourselves. Let's start there. And that's, everyone's going to have heard this before, because we all know it, but it needs repeating constantly, because none of us, I think, have got it nailed down perfectly. Think basic practical things like, we're all guilty of this, me too. Don't stay up till 1 o'clock in the morning watching rubbish on the TV. Go to bed. We need sleep. Young people especially need plenty of sleep, and you will feel much better for it. Now, I do remember being 20 years old myself, and maybe this is not the advice you want to hear, but that's one part of the the general advice on looking after ourselves. Try to make sure we eat reasonably healthy diet. Try to make sure that we move ourselves and exercise,
Exercise,
all those
no
kind
matter
of
what.
things. All of those things, we all know that, but it is so important. It's fundamental, and it's totally within our own control as well. But on the other side, that's the physical aspects, which are a bit easier. But then the mental things, if we go back to the mental health question and the mental health issue, this is really important. Know your sort of limits. How long have you been on social media? Has it been the last 4 hours? Is it maybe time to stop? Put it down, go outside, do something else, spend time with friends, with family. Just think about your stress levels, think about your exposure to especially the online world, which maybe in certain cases is not helpful. Think about time management. All those kind of self-care things, I think, are really important. Next, once you've got that baseline, is to educate yourself. Stay informed, read reliable sources of information about what is happening in the world, in other parts of the globe, particularly on this subject. There are, in Europe, we're pretty, most of us are pretty fortunate to live in developed countries where we've got access to healthcare, and we don't really think about if we get ill. We, as you said before, we just phone the doctor, we take an appointment, we get some medicine. This really is not the reality for billions of people. So let's educate ourselves. Let's seek out information. Go to the World Health Organization's websites, subscribe for their emails and their newsletters. Go to the Centers for Disease Control, great US government source of information, the National Health Service in the UK. There's lots of things. Also, I would say, be a little bit aware of where you get your information from, because not all information is equal.
Always on the trusted sources. So I was reflecting then.
Absolutely.
So I take out the 3M. One is moderation, as you say. So take it, get to the moderations. Okay, moderation. Social media, moderation.
Yeah.
Have a busy life and productive life, but also moderation. Get some good sleep over there. Good mix of health, of being fit, eating well, and so on and so forth. But also the third, this will make you healthy and definitely more successful and contributing to your own well-being and the well-being of others. Thank you so much, Zoe, for being with us today. It has been amazing. I'm sure our youth are going to enjoy this podcast. If yes, comment down here and definitely do three things: like, 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 And other three, share, share, share. Okay, thank you so much, Jenny. 2024, it's at full speed this year. Hundreds of thousands of young people expected on the virtual expo throughout the year, and then Jenny 2024 in Catania, Italy. Thank you so much to J&J, Johnson and Johnson. Thank you so much to Zoe Lawson for being with us.